Hello everyone! I hope that you can hear me okay. I'm going to just kind of make sure the sound is up and everything. But greetings to you. Happy Tuesday. Welcome to Fix Yourself with the Yummy-Yucky workshop. That's right. We are going to look at yummy and yucky today. High-tech stuff. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy, a certified athletic trainer, and a fitness nutrition specialist. I help people feel better faster through physical therapy, fitness, food, and fun so that they can live their life, their best life, without worry of re-injury and a health scare that will prevent them from doing what they want to do. Today we are going to discuss, and I'm going to share with you how I help people fix themselves so they can feel better and also feel empowered to be able to fix themselves at home. It is a 7-step process that I do in my office as well as online through telehealth. What I typically get asked is 3 questions. The first question is, can you help me? The second question is, how long will it take to get better? I translate that to, how long do I have to come and see you? And then the third question I get is, what can I do at home so that I don't have to keep coming to physical therapy? Let's tackle those questions. And whether you're on here live or whether you watch replay, just go ahead and hit, team replay in the comments below and introduce yourself as well as you're coming on. So let's answer the first question is, can you help me? Well, in most cases that are musculoskeletal, physical therapy can help you. So if it's a muscle strain, if it's a ligament sprain, if it's a sports injury, or if somebody has a fear of falling, if somebody's been in a car accident, maybe has had whiplash or a concussion, these are all things, including jaw pain, ankle sprains, back pain, neck pain. These are all things that a physical therapist can help with. So there's a lot of situations where a physical therapist can be the first best option. Now, there are also situations where a physical therapist isn't the best option. Obviously, if somebody's having an emergency, they need to call 911 and go to either via ambulance or go to the hospital, urgent care or an emergency room. In other situations, people have come to see me and I'm suspecting a fracture or a stress fracture, or I'm suspecting a ligament is torn. These are situations where they need further diagnostic testing. So I recommend that they get an x-ray, or I recommend that they get an MRI, and I refer them to the physician. I'm not the best first option, but I would be a good second option after they've been to the physician and had those diagnostic tests. The second common question I get is, how long do I have to come see you? Or how long is this going to take to feel better? And this depends. If somebody just had an injury, then it hasn't been around very long. So if somebody steps off of a curb and they roll their ankle, then what can happen is they go through a healing process, but they might not need very much physical therapy after that. Now, if somebody's had a chronic problem where it's been there for months or even years, that's going to require a lot more visits than somebody who just had an injury happen, and it's not surgical. If somebody has had surgery, that can be several weeks of physical therapy to fully recover and get back to what somebody wants to do. And that brings me to the 5 phases of rehab. When I have somebody come into my office, I explain to them about the 5 phases of rehab. The first phase is getting rid of the pain and tightness. The second phase is helping them improve the way they move. The third phase is getting stronger and more balanced. The fourth phase is getting back to the things that they want, or excuse me, the things that they need to do. And the fifth phase is getting back to the things they want to be able to do. Those are the 5 phases. And we have to work through all 5 phases so that the problem is solved and is not going to come back, or is less likely to come back. When I see somebody and they want to, so the third question I often get is, what can I do at home so that it doesn't come back? And let's just face it, nobody really wants to have physical therapy. Nobody wants to come see me. The reason they come see me is they couldn't fix the problem on their own. And for the most part, people will live with a little bit of pain, but it's when the pain or when their stiffness doesn't allow them to do what they need or want to do. And they can't figure out how to fix it themselves. So when they're not able to do what they need to be able to do, that's usually when they seek out someone like myself who can help them figure it out. When people come and see me, I understand that they don't want to see me forever. They want the problem resolved so they can move on with their life. And that's my job, is to help them realize how to fix themselves so that they can take care of the problem when they are finished with physical therapy, or they can prevent the problem from coming back. Now, how do you know when you need to seek out physical therapy? Well, my rule of thumb is generally if a problem isn't going away within 5 to 10 days, you probably need to seek intervention. And because that problem's probably not going away on its own. Most situations where maybe you go out, you rake leaves for the first time in the fall season, and you kind of feel like, oh, I'm a little achy, you know, that's probably going to resolve in 24 to 72 hours. But if it kind of lingers past that, it's probably not going away on its own. And it needs some medical intervention to help it go away. The other reason I don't like people to wait more than 10 days is because of what the research says. And the research says that if somebody receives physical therapy within the first 5 to 10 days of their injury, they are more likely to recover faster from that injury. They are less likely to require pain medications, which means they're less likely to get addicted to pain meds. And in many cases, they're less likely to require surgery. So those are all really good reasons to go and seek out a physical therapist within the first 5 to 10 days of an injury. If it doesn't go away within 10 days or it's not getting significantly better, like I said before, it's probably not going away on its own. Now, here's the reason why people don't get better on their own. Number one is rest typically doesn't work. That's what most people want to do if something hurts. They're like, oh, I'm just going to rest it. I'm going to give it a couple days. I'm going to rest it. But rest, for the most part, doesn't typically work because it creates other problems. If you're resting and you're not moving, then some people will start to feel stiff, they'll start to feel achy or sore, and then over a period of time, if they're waiting and resting for long periods of time, they start feeling kind of weak. So resting typically is not the answer. The other thing is resting doesn't solve the problem. In order to fix a problem, you have to know what the problem is. And until you know what the problem is, you can't solve it. So resting doesn't solve the problem. It doesn't help us to understand what happened or why it happened. And until we know those things, we can't solve the problem. So here's how people can have the most success and how they can learn to fix themselves. It is a 7-step process, and this process is called total motion release. It was actually created by Tom DeLonzo Baker. And you can go ahead and look him up online. You can Google his name. You can Google total motion release, and you can vet that information. But lots of physical therapists use this technique. I've gone through the level 2 training, and actually in 2 weeks I'll go through the level 3 training. So I've been using total motion release for a while because it is very effective and It empowers patients to know how to fix themselves. I'm going to go through all 7 steps, and then we'll go through some examples of what to do in each of those steps. So step number 1 is you test the entire body for motions, and you're looking for what feels yummy and what feels yucky. Step number 2 is you test motions in the regions or the areas of the complaint. Step number 3 is you're actually going to score and record the yucky movements. So I actually have a scoring sheet. So in my office, I score this for people. If I'm doing a telehealth visit, then I actually have sent this to people in advance, or I am filling it out with them as we go through it online. Step number 4 is start exercising, or in this case, treating. We're treating the problem. Step number 5 is we retest all the yucky movements that we found in step number 1 and step number 2. Step number 6 is you use rules to fix yourself for what to do next. So I actually have another handout and rules to fix myself, and patients get this as well. Step number 7 is you repeat this whole process until there's no further improvement. And this may only require about 1 or 2 exercises. So let's walk through this a little bit, and we're going to try it. Let's look at the Fab 6 movements. So the first movement is actually, you can do this in standing or seated, is raising an arm up. So we look at one side, then we look at the other. And we see which side's yummy, which side is yucky. Then the next movement, I'm going to step back and use this door frame for a bit, is called a shoulder press. And I'm going to put a hand on the door frame, and I'm just going to step forward on one side and repeat on the next side. And I'm going to figure out, okay, which side felt yummy, which side felt yucky. The third exercise is a trunk rotation. So if I'm sitting in a chair, I'm just going to rotate to one side and then rotate to the other side. Which side feels yummy or yucky? So on that one for me, when I rotated this way, I felt a little bit of a strain in my back. So I'm going to make note of that, and I'm actually going to write that down on my form and say left seated rotation. And I'll just say, let's say it's about a 20, and I'll go through this in a little bit, but I'm going to make a mental note. Then the next motion is a seated leg raise. So I'm going to keep my legs straight, and I'm going to raise up. And raise up. And let me move the camera so you can see that just a little bit better. So I'm going to have my heel down on the ground. I'm going to raise up and compare the two sides. Which one's yummy, which one's yucky. The next one is a sit to stand with one leg. This one can be challenging for a lot of people, so I let them use their hands if they need to, because I don't want them to fall. So they push up, and then they switch and do the other side. And then the next one and the last one, remember this is the Fab 6. They're going to step and step. Which one felt yummy, which one felt yucky? So remember, I said that when I rotated to the left, I felt that a little bit. And I'm going to record that on my sheet. So then what I would do is I'm going to go and I'm going to start exercising that. So when you record this, and I know that you can't see this, if you want this, just comment in the feed below me, and I will make sure that I reach back out to you. So I record. Now, what we look at is we record whether it's a low issue, a medium issue, or a high issue. A low issue is like a 1 to 30. We're using a 100-point scale. So 1 to 30 is a low issue. A medium issue is going to be 40 to 60, any number between there. And then a high issue is 70 to 100. Pick any number. So 0 is no issue at all. 100 is like worst issue ever. You got to go to the emergency room. That's how I classify that. So we have low, medium, and high. Remember what I said. I said when I went to the left, I felt maybe about, I think I said a 20. So what I'm going to do is start exercising that. But I'm going to use the yummy side to actually fix the yucky side. So I'm going to come back here, and this side was, oh, I kind of feel that. I would say that's a 20. I'm going to actually use the yummy side because I don't feel anything on the yummy side. So I'm going to rotate, and I usually start with 2 sets of 8. So here I am. I'm doing 5, 6, 7, 8. And I pause, and then I'm going to go right into the second set. 4, 5, 6, 7, 8. And I do 2 sets of 8. Now I'm going to retest. So if we look at our steps, step number 5 is retest the yucky movements. So I'm going to go back and I'm going to retest, and now I would say that's a 10. That dropped from a 20 to a 10, so it helped 50%. Okay, so now I got to look at my rules. And I have my rules page, and it says rule number 1. If my score improves, I do the same exercise. Okay, I'll tell you the other rules too, but then I'll go back and I'll do the exercise again. Rule number 2 is you tweak it. If your score has little to no change, then you tweak it. And rule number 3 is if the score increases, meaning your symptoms get worse, then you have 3 options that you can do to do rule number 3. Well, my symptoms on my score was a 20 at first, and then it went to a 10. So rule number 1 applies to me. And I'm going to do the same exercise again, the exact same way. So now I'm sitting again, and 2 sets of 8 rotating to the right decreased my symptoms on the left by 50%. So I'm going to rotate to the right, 2 sets of 8. This is 5, 6, 7, 8. Take a little pause, and I'll do the second set. 1, 2, 3, 4, 5, 6, 7, 8. And I'm going to go back and I'm going to retest. So, and now I feel nothing. It went to a 0. So just by doing that exercise and retesting, I took my pain or my discomfort, because it was a low issue of 20, down to a 0 with 2 sets of doing 2 sets of 8. And that's how I fixed myself. I'm done. If I was a patient in my office and everything else cleared, so when I had them go through all 6 of the Fab 6, and they did the arm raise, they did the shoulder press, they did the rotation, they did the leg raise, they did the sit to stand, and then they did the excursion. If the only thing that they came in with a problem after looking at all of those body movements, the only thing was seated trunk rotation to the left at a 20, and we took that down to a 0, we're done. That's how simple this can be. So if they were in my office and they went from a 20 to a 0, and all the other motions cleared at 0, we would be finished. And the only exercise that they would have would be 2 sets of 8 rotating to the right. If I were to give that as a home exercise program, I would have them at home. This is what they would get. They would get their tracking form. They would get the rules to fix themselves. And then I usually give the pain scale too, which is that 0 to 100, so that they can see if it's a low issue, a medium issue, or a high issue. Then what I have them do is I have them do the Fab 6. The Fab 6, I have them do that once a day and check. If everything is a 0, they're done. They don't have any pain. They're moving fine. They've cleared every single movement that we've looked at. And then they come back and we figure out what the next step is for them after that. But now they can fix themselves at home without me, and they can bring their homework back and show me on their tracking form what they've done. So I usually send that to them via email so that they can print out multiple copies and they can do that. Now I have them at least check their Fab 6 exercises once a day. If they have no symptoms, meaning they're at a 0, they're done for the day. If, however, they still have some issues, then I usually will say, I want you to do this twice a day. Because what we're doing with the Fab 6 is we're checking for what is out of balance, what is asymmetrical. When the body is asymmetrical, it will compensate. And when it can't compensate anymore, it will feel pain, discomfort, tightness, stiffness, maybe even apprehension with movement. And so those are all symptoms that somebody might be describing when they come to see me. And we, regardless of which symptom they're describing, we can use total motion release to fix themselves by comparing yummy movements and yucky movements. And then what we do is we use the yummy movements to fix the yucky side. And that's basically taking somebody through a full 7-step process to fixing themselves. Thank you very, very much. Hi, Holly. Thanks for tuning in. And so if you have questions about that, feel free to reach out. Just comment below me and I will reach back out to you. I will, if you want copies of the pain score system, the rules to fixing yourself, and then of course the tracking form, all of these tools help you learn to fix yourself. If you want to go through this, obviously I can't see your movements, but if you were in my office, we would go through this. If you were on a telehealth visit online, then we would go through these movements and we would do this together. But it's a nice, simple way that you're checking your entire body. When we do the arm raise, we're looking at the shoulder and the neck and the mid-back. When we do the shoulder press, we're actually looking at several things. We're looking at the shoulder, the hip, the back, and even the opposite leg. And you're checking both sides. When we look at trunk rotation and a seated position, you're looking at your back and your spine rotation, as well as how you rotate from your back to your pelvis. When we look at the sit to stand, oh, I skipped one. When we do the leg raise, we're looking at hip and leg, and sometimes even a little bit of back. Sometimes people will feel a back strain if they lift their leg. When we do sit to stand, we're looking at leg strength and range of motion. And then when we do this excursion, we're looking at leg strength and balance. So we're clearing the body from the upper body to the lower body to see what side and what movements feel yummy and what movements feel yucky. And then we're looking at using the yummy movements to fix the yucky movements. Thanks, Nancy, for tuning in. I appreciate it. So when I have somebody come through these, we use all these tools. We use the Fab 6, those 6 exercises. We track the yucky movements. We track their pain score. Is it a low issue, a medium issue, or a high issue? And then we use the rules to fix yourself. So this is really called the rules to fixing myself. And rule number 1, just to recap, rule number 1 is if my score goes down, meaning it feels better, then I do the exact same exercise to treat it. If my score has little to no change, then I use rule number 2. And if my score increases or gets worse, then I have 3 options within rule number 3 to fix myself. So this is a great way for people to help themselves and fix themselves at home when they're struggling with some aches, some pains, or maybe you're not having an ache or a pain. Maybe you're having discomfort, maybe you're feeling stiff, or maybe you're feeling weak. We can use the yummy side to fix the yucky side, and what that does is it puts the body back into more symmetry so that it's not asymmetrical or off balance, and we clear the body from upper body to lower body with those 6 movements. Now, what do you do when all 6 movements are 0? You have no symptoms with all 6 of them? Well, there's a lot of tweaking we can do, and that's for probably another training or another workshop, but there's multiple layers to this. There's a lot more exercises beyond the Fab 6 as well. So when people kind of graduate from the Fab 6, we go to another set of exercises. But the Fab 6 is our basic testing that we can use from the beginning when somebody is not feeling at their best. I hope this was helpful. If you have any questions, please don't hesitate to reach out. You can comment below. Just say me if you want me to get in touch with you. If you're watching this on a replay, just say #team replay and I'll reach back out to you as well. You can also call our office at 262-771-0404. You can email us as well. That's jdwitt@apexnetworkpt.com. And I just look forward to chatting with you. Start a conversation with me. There's no reason to suffer with aches and pains unnecessarily. And if you've been suffering, like I said earlier in the conversation, if you've been suffering for more than 10 days, you definitely want to reach out. Because when something is not going away within 5 to 10 days, it's probably not going away on its own. Thank you very, very much. Look forward to chatting with you soon. Have a great day.